Okay, well, look, I think we might get underway. Without further ado, just to introduce myself, my own name is Ciara, Ciara Hegarty, and I'm one of the student support officers here in the University of Limerick in the Student Affairs Division. So I'd like to welcome everyone to the live presentation 2. I sat in on the live presentation 1, and there was such a fantastic calibre of students there, so I'm sure we're going to have a similar calibre of students here today. So in this afternoon session, we will have 3 students presenting. The 3 students are from the University of Limerick, and they are from the Faculty of Education and Health Sciences and from the Department of Nursing and Midwifery. So we have Ciara Walsh, Evan Brennan, and Deirdre O'Brien that will be presenting. So each presentation will be 10 minutes. I will let each of the presenters know when they'll have a minute left, and we might have a little bit of time after for any questions from the audience also. So without further ado, I'm going to hand over to the first presenter. I think we have Ciara Walsh here. Ciara is a student, as I mentioned there, from the University of Limerick. She is studying the Bachelor of Science in General Nursing, and her paper is Does Pediatric Sepsis Screening Assist in the Early Recognition of Sepsis in Children in a Hospital Setting? So I'm going to hand you over to Ciara. Ciara, if you would like to take over there and share your screen if you can with us.
Can you see my slides? I have them up there.
We can indeed, Ciara. We can see them now.
Perfect. So my name is Ciara Walsh. I'm a 4th year BSc Nursing General student, University of Limerick. And my research piece is Does Pediatric Sepsis Screening Assist in the Early Recognition of Sepsis in Children in a Hospital Setting? A focus mapping review. So to begin, what is sepsis? Sepsis, which can also be known as blood poisoning or septicemia, is caused by a dysregulated response in the body to infection that overwhelms the child. It can develop anywhere in the body, with the most common causes being pneumonia, influenza, and urinary tract infections. Without treatment, sepsis can escalate very quickly to severe sepsis, which is sepsis with a failure of at least one organ system. And this can progress to septic shock, which is severe sepsis with hypertension or low blood pressure that does not respond to fluid resuscitation, and this can be quite fatal for patients. Pediatric sepsis is the leading cause of death worldwide, resulting in 7.5 million deaths annually in the pediatric population. Early recognition of pediatric sepsis results in improved outcomes, but it can be difficult due to lack of diagnostic tests and the non-specific clinical presentations of pediatric sepsis, which mimic those of other childhood illnesses such as influenza and bronchiolitis. Sepsis screening tools, which can be automated or manual, were developed to assist in the recognition of pediatric sepsis. Sepsis screening assesses a child based on set criteria that indicate signs of systemic and inflammatory response or organ dysfunction using a combination of vital signs, laboratory tests, risk factors, and clinical presentations. Pediatric sepsis screening is implemented through national guidelines and the Surviving Sepsis campaign, despite there being a lack of evidence to support its use and a lack of clarity in the optimal screening method. The most recent policy in Ireland in relation to paediatric sepsis screening is from 2014 from the Department of Health in collaboration with the National Clinical Effectiveness Committee. It published National Clinical Guidance on Sepsis Management, recommended that sepsis screening should be completed in all children presenting on well or deteriorating. But this guidance, it isn't supported with any evidence or any guidance on which screen should be used. The lack of evidence highlights the need for clarification on the effectiveness of paediatric sepsis screening and the optimal screening method. This review aims to bridge this gap and establish that paediatric sepsis screening is effective in recognising sepsis in addition to what screening should be used. So using an adaptive version of Bradbury's focus mapping review process, a focus mapping review was completed. It was adapted by the Department of Nursing and Midwifery New Well to make it achievable for students to achieve the research project within 9 weeks. It differs from other forms of review inquiries because it responds to questions concerned with what is happening in the field, making it very applicable to nursing midwifery due to the constant requirement for the most up-to-date evidence in the field. The features of the method are the focus on a specific subject to identify trends in the area and evidence to inform clinical practice. A descriptive map of key features of research in the field is developed. Specific journals are targeted and selected and are likely to contain articles with information relevant to the inquiry, and their reviews within a defined time period, and findings have the potential to inform practice. So the focus of this review is to examine literature from September 2020 to 2021 to identify the effectiveness of paediatric sepsis screening and recognising sepsis early in children in hospital. This review aims to identify the most up-to-date literature to inform future practice. and the objectives are to gain understanding of the different types of sepsis screening used for children in hospital, to highlight both the positive and negative effect of the identified sepsis screen, and to establish a pediatric sepsis screening assists in the early recognition of sepsis in children. The first step in this review was creating the review question, which was developed using the population exposure outcome format known as PEO, with population being children with sepsis in hospital, exposure being pediatric sepsis screening, and outcome the early recognition of sepsis. And these keywords and the different terminology were then used for search literature within the journals. As previously mentioned, within a focus mapping review, the objective is to select an article, and it's more than selecting journals on their likelihood of publishing the relevant literature rather than doing a large database search. However, prior to selecting the journals, a broad search was completed on Sinhal and Scopus database to identify the highest ranking journals in the areas of pediatric sepsis. The 5 journals as seen in the slide here were purposely selected on their likelihood of publishing the relevant literature. Each journal was searched in SJIT or Skigamo journal and country rank to identify the journal metrics and the impact factor. Each journal was then searched individually for relevant literature that could answer the review question. As a result, 10 articles were generated from the search process, and they were all screened using titles and abstracts. Following the screening process, 5 articles remained from 5 different journals, and adhering to inclusion and exclusion criteria, these 5 articles were included in the study. So inclusion criteria included articles that were published between September 2020 to 2021, where the population was children aged 0 to 15, and different types of papers such as randomized controlled trials and quality experimental studies. Exclusion criteria excluded papers outside September 2020-21 and papers that focus on neonatal or adult sepsis, in addition to editorials, opinion papers, and policy statements. The next step was mapping the findings to the review question. A data extraction table was utilised to assist in mapping the findings to the review question. The findings were extracted from the 5 papers based on predetermined headings that matched the objectives of the review and could answer the review question. And they were types of screening used, positive of the screen, negative of the screen, and does it assist in the early recognition of pediatric sepsis. And the use of these headings enabled the author to easily map the findings to the review question. To summarise these findings, just to reiterate, pediatric sepsis screening is recommended and implemented in practice despite there being lack of evidence to support its use in recognising pediatric sepsis, in addition to no clarification on the most effective screening method. As a result of this review, it was found that there is a gap in the literature on pediatric sepsis screening, especially from an Irish and European perspective, with the majority of literature being from the United States. Sepsis screening in general was proven to be sensitive, specific, and well integrated clinical practice and played a central role within sepsis care bundles. Pediatric sepsis screening can assist in the recognition of pediatric sepsis, with automated screening being the superior sepsis screen, as it is sensitive, specific, allows for continuous sepsis surveillance, and screens all children coming into hospital, rather than the manual that just screened children that were presenting unwell. However, automated would slower recognising sepsis compared to manual and could sometimes fail to identify sepsis in a child. Sepsis screening improved significantly when using conjunction with clinical judgment, and it found that the nurse played a central role in the recognition of pediatric sepsis and often identified a child with sepsis despite them receiving a negative sepsis screen. The last step was generating the implications for practice. To begin with research, it is evident with the findings there is a need for further research on pediatric sepsis screening, especially from an Irish perspective, to establish the impact of automated sepsis screening on quality care, patient safety, and ethical issues. In relation to practice, this review has implied that pediatric sepsis screening is effective at recognising sepsis, with automated sepsis screening being the optimal screening method. To improve pediatric sepsis screening, a recommendation for practice will be to replace paper-based and manual sepsis screening with automated screening used in combination with nursing assessment. In addition, to improve future practice, the current policies on pediatric sepsis screening need to be updated in Ireland, with the recent policy being from 2014. And lastly, in regards to education, both nurses and student nurses should receive education through e-learning modules on pediatric sepsis, the clinical presentations, and how to escalate care after a positive sepsis screen. Through education, the role of the nurse in identifying pediatric sepsis can be empowered to further improve the early recognition of pediatric sepsis. And there are my references, and thank you.
Thank you, Ciara, for such a comprehensive presentation there. I'm going to stop screening for a moment and I would invite anyone that has any questions for Ciara to raise their hand or to turn on their mic if you have any questions in relation to Ciara's presentation.